So welcome to Providing Rape Crisis Services to Incarcerated Survivors. This is part 2 of our two-part series on the basics of providing rape crisis services to survivors behind bars. Part 1 was last week, and it focused on setting up services and building strong relationships with the facilities in your area. Today, we're going to be diving more into actual best practices when you really are providing these services to survivors behind bars. So whether you've been doing this for a long time or not a long time, whether your agency is completely new to this work or has a well-established practice, we welcome you today, and we're very happy to have you joining us. Everyone who has registered will be receiving a follow-up email, which will contain a certificate of participation, as well as links to some of our handouts and other resources that we hope are helpful for you. And I am Matthew Van Winkle. I use he, him pronouns, and I'm a senior program officer with Just Detention International, or JDI for short. And I'm joined today by my colleagues from CalCASA and JDI.
Good morning, everyone. My name is Chris Mady. I use they, them pronouns, and I'm also a senior program officer with JDI.
Good morning, everyone. I'm Marcela Rojas Salas, and I'm a program coordinator with CalCASA, and I use she, her pronouns. Welcome, everyone. And a little bit about CalCASA. We are the California Coalition Against Sexual Assaults, and we're committed to ending sexual violence through a multifaceted approach of prevention, intervention, education, research, advocacy, and public policy. CalCASA provides leadership, vision, and resources to rape crisis centers, individuals, and other entities committed to ending sexual violence. And CalCASA envisions a world free from sexual violence.
And for those who don't know, Just Detention International, or JDI for short, is a health and human rights organization that seeks to end sexual abuse in all forms of detention. It's JDI's core belief that when the government takes away someone's freedom, it takes on an absolute responsibility to protect that person's safety, and that no matter what crime someone has committed, rape is not part of the penalty. We're speaking to you today through the California Advancing PREA project, which is funded by the California Office of Emergency Services, which allows Just Detention International and CalCASA to partner in offering support and guidance to all California rape crisis centers on setting up, building strong relationships with California state prisons and local county jails, and that we can provide TA and training such as this one, all towards creating sustainable programs for you to serve incarcerated survivors. PREA. I'm assuming that most everyone on this webinar is already aware, but I would be remiss not to state that PREA is a word you're going to hear a lot. It is an acronym for Prison Rape Elimination Act, which is a federal law aimed at making American detention facilities safer by requiring them to take certain steps to prevent, detect, and respond to the sexual abuse and sexual harassment of those in custody. So that's what we mean when we say PREA. And here's a look at what we'll be going through today. We'll be starting by kind of reiterating the importance of your role as a victim advocate, the uniqueness of that role, and providing a recap briefly of what was covered last week. And then we'll go into depth about actually providing services to incarcerated survivors behind bars. Talking first about hotline calls, moving on to written correspondence and forensic exam accompaniment. And then we'll move on to advocacy, what that looks like in a detention setting, and discuss providing in-person services, both one-on-one counseling and groups. And as I mentioned before, we do want to be able to speak to your questions, things you're wondering about, and this is the way you can ask questions. If you see the graphic that is I guess in the upper left, relative to the two pictures here, this is what the interface should look like if you're joining us via a computer. You can find the questions pane of the control panel there and enter your questions. And then if you're joining us on an iPhone or smartphone, this little box here to the right is what it would look like in that case. So you don't need to wait. You can ask your questions whenever they occur to you. This is also the space that you can use to answer the questions that we'll be asking of you from time to time. And as always, we encourage you to practice self-care during this webinar and through the rest of your day. Take deep breaths, step out as needed, stand up and stretch, drink water, whatever it takes for you to feel most whole. That is what we would have you do. So please keep that in mind, as this is not always an easy topic to hear about. Before we dive into the services that you can provide to survivors within your local facilities, we want to do a quick recap of last week and highlight kind of the importance of victim advocates in the healing of incarcerated survivors. It'll help us remember why this work is so important, and we'll do a quick assessment of where you're at currently in your advocacy work and the relationships you hold with the corrections staff and the survivors in your area who are incarcerated. Many of you have seen this, this number before, this graphic before. According to an estimate by the Bureau of Justice Statistics, which is where we get most of what we know about this problem, roughly 200,000 people are sexually abused in American prisons and jails each year. 200,000, and that represents the number of people, not the number of incidents of abuse, because many of these 200,000 people are in dynamics where they are abused multiple times over the course of a year, and not always by the same perpetrator. The available data on perpetrators of abuse in adult detention settings is nearly equally split between inmate on inmate abuse and abuse that is perpetrated by staff. I want to be clear that when I say staff, I don't mean uniformed people with badges or ranks. Staff can mean anyone who is free to leave the facility at the end of the day. It could be a volunteer, it could be a mental health worker, it could be someone working in the kitchen. Anyone who gets to leave at the end of the day is what we mean by staff. And there is nearly even split of perpetration between staff and inmates. We also want to make sure that we are aware when we use that term incarcerated survivors, that term can refer not only to people who have been harmed while in detention, but also to people who maybe experienced abuse prior to entering the system, either child sexual abuse or intimate partner violence or rape before they entered the facility, because PREA has been written to make sure that anyone who is a survivor at any time in their life should have that access to emotional support services from a rape crisis center while they're in detention. We know that there are some additional barriers to healing that a survivor who is incarcerated may face, that it can be very helpful for advocates to be aware of. I guess the obvious example is that when someone is incarcerated, they have very little or minimal control over their body or their environment, as well as a general lack of privacy, which can feel very reminiscent of an abusive environment from which they may have experienced in the past. It could remind a survivor of how they felt, how powerless they felt when they were assaulted. And this is just exacerbated by the general lack of autonomy experienced by folks who are in custody. Like any survivor, even in the community, the feeling of being alone in their trauma and healing is especially true for incarcerated survivors, where they may literally be isolated from other people in a cell. So with these additional challenges to healing being what they are, sometimes a survivor's reactions to trauma may be heightened. Things like the use of restraints and invasive searches, which are commonplace in a jail setting, can also be incredibly triggering for a survivor. Unfortunately, many times staff might misunderstand these trauma responses that a survivor is demonstrating, and they may be punished for what is actually a normal response to trauma. They may be seen as problematic or troublesome, refusing to follow instructions, or having other issues, emotional issues. And additionally, for survivors that report the abuse in detention, there is the strong likelihood that they may be forced to have ongoing contact with their perpetrator. So there could be a real fear of retaliation for reporting. So it's very important. The role that rape crisis centers have to play in the healing of those who are incarcerated is very important. The Prison Rape Elimination Act, or PREA, also recognizes the importance of rape crisis services for survivors who are in detention facilities. It requires that facilities must enter into a memorandum of understanding with community service providers like rape crisis centers, who can provide confidential emotional support services related to sexual abuse. It requires that they make that access something that everyone at the facility can access by sharing the Rape Crisis Center's phone number and mailing address, making sure that it is posted on walls, in common areas, in intake literature in some cases. The facility is required to make all inmates aware of the extent to which such communication will be treated as confidential. And they must make victim advocates available to survivors during forensic medical examinations and investigatory interviews. So PREA stops short of requiring that facilities to make in-person services available. But we know that in many places, especially prior to the pandemic, we've seen wonderful programs being carried on in California prisons and jails by rape crisis centers, and that there's such a positive outcome, and kind of a general improvement of the facility's cultural health as a result of these services. There's a very strong case for providing these services once it's again safe to do so. So we see what we're talking about today, the hotline, the letter writing, the forensic accompaniment, as sort of the basics, the core, but it is always worthwhile to pursue more in-person presence at the facility. Of course, Chris will be talking about that a little bit later. So as advocates, we're in a position to be there for a survivor when no one else is. The need for such an advocate is illustrated in this quote from Frank, who was a prisoner rape survivor who did not have access to an advocate when he needed one, when he was raped in a sheriff's jail. If I had an advocate, it would have saved me so much grief. It would have helped me through that traumatic event immensely. Going through it alone, I didn't know who I could trust and who I could talk to about it, which appeared to be nobody. So we're going to take a minute or two and hear from Martin. Martin does not identify as a survivor, but he has a lot of insight into the perspective that someone who's incarcerated and reaching out to you for services might have.
If a lot of things got reported the way they were, they'd realize how the system is so broken. We inmates have a code of silence, and correctional officers have a code of silence too. And sometimes that code of silence is extremely dangerous, because once that silence gets broken, a lot of people are at risk. A lot of times there's this thing where we feel we're going to get rejected, we're not going to be accepted, we're not going to be worthy of help, right? But knowing that advocates are there, their role can actually save lives. We're full of emotions. We just can't show them. In a sense, a lot of us are already broken when we're there. And I think it's important for advocates to be there, ready, willing, and realize that, you're not just dealing with a broken person, but somebody who really needs to be put back together. Take me, for example, if I was to reach out for help in there, I wouldn't know how to talk to you. I would be afraid of judgment. I'd be afraid of too many questions at one time. I'd be weary of talking to somebody who doesn't know me. And I'd also be weary of, like, who are you talking to? You're talking to me, but are you talking to somebody else? The advice I'd give an advocate is just kind of put some guidelines out there, who you are, what your intentions are. And if an advocate can show me their real side, not their personal side, but just who they are as a real person, then I'm more likely to open up. If I reached out or one of my peers reached out, that individual is ready to talk. And all the, a lot of times a gentle smile and a joke really does lets my exterior down a little bit. I know that a lot of advocates or people doing that work also are filled with news media and these lockup shows and stories about what we do in prison, right? And I think the more people watch those things, the less human I become. As hard as my exterior can be, there's this humanness about us, like I said, we're broken, and you have the skills to help us out. It's the same skills you have when working with a non-inmate. I'm a human who needs help.
All right. Was there anything that Martine said that kind of stood out for anyone here? Any words that he shared that really caught on for you? Anything he said that maybe was surprising? Or yes, that's a great point. He said that he needs to know who we are talking to, and that is so crucial. That is why PREA requires that. That's why PREA requires that facilities partner with outside rape crisis centers and not just going to mental health or hiring their own counselors, because they recognize the need from the survivor's perspective to talk to someone who is completely not a part of the corrections facility, of which they're where they're held prisoner. Yeah. Mm-hmm. So yes, yeah, Martine needs to know that you are not, a professional, or that you're not a coworker of perhaps his abuser. Yeah. The humanizing aspect of an advocate. Mm-hmm. Yes. The video is absolutely available. We'd be happy to share it with you, and I will be sending it along in the follow-up email. Yeah, he talks about how television and movies kind of distort and dehumanize those who are inside. Mm-hmm. Yeah, and he needs help. That's right. Yeah. And Carla, yes, that the advocacy skills are going to be the same that you would use on the outside in the community, and that if someone has reached out, they're ready to talk and they're ready for help. Yeah. Thank you all so much for your feedback there.
And thank you, Matthew, for sharing that video and for your responses. That's really helpful. And I think what I like to use is the empowerment model. And a lot of what Martine was speaking about is echoed in this model. For those who haven't heard of it, One of the main tenets of the empowerment model is that the survivor and not the advocate is the expert in their own lives. And this is why when we're talking with or writing to a survivor, that we're offering options rather than advice, and we're not telling anyone what to do, especially as what works for one person might not work for somebody else. Another piece of the empowerment model highlights the importance of confidentiality and being transparent about your limits, just like Martine mentioned. When working with all survivors, and especially incarcerated survivors, it's very important that we're explaining where we're working and who we're sharing information to. And so, as a lot of you mentioned in your response to watching the Martine video, is that many of the skills that we have when we're working with survivors in the outside community, those are very transferable to working with survivors who are inside detention. However, there are a few key areas where it's important to make a few adjustments. The three areas that we need to adjust tend to be in the referrals we make, the safety planning we provide, and the coping skills that we offer. Given that resources are limited inside of a detention setting and that trauma reactions may be heightened for someone who is incarcerated, when we're working with someone who is inside detention, the safety planning, the coping skills, things like that, those are going to have to look different than the skills and plans we offer up to folks in the community. Whereas in the community, we might help a survivor come up with a plan to avoid a perpetrator, for instance. This might not be possible in a detention setting where a survivor has little or no control over their own movement within a facility. Also, if the perpetrator is a staff member or a gang member, reporting who the perpetrator is might not be a safe option for the survivor. Just like going to the police for some folks in the community can be more harmful than helpful. And this is why offering emotional support and coping skills can be so important, as it's one of the main ways we can offer tangible support to survivors. So let's talk a little bit more about making referrals. When we're in the community and we're working with folks in the community, we generally provide a wide variety of referrals to outside organizations. This is not going to be possible for folks in detention, as again, they have little or no access to making outgoing calls or to search things on the internet. So if you're offering a referral, it's very important to make sure that the organizations you do provide services specifically for people who are inside jail or prison, and that there's an easy way for someone who's incarcerated to contact them, such as a solid mailing address or a phone line that takes collect calls. If you're making referrals to somewhere inside the facility itself, it's important to note that many survivors are not trusting of internal support, and that these services, such as correctional mental health, are often incredibly limited and may not offer the appropriate care. Survivors have often already tried facility-based support and have had bad experiences, and pushing them to try them again may break the trust that you've built with the survivor. Also, understand that in many systems, there's a cost associated with both medical and mental health care, and this might make it so it is not accessible to a survivor, and it feels that there's a strong barrier for them to access these things. Also keep in mind that the reality is that you may be the only resource for that survivor, so it might not make sense for you to make a referral. So let's do a quick poll here, and you'll see the poll comes up on your screen, and the question we have here is, has your agency identified relevant and reliable organizations to refer incarcerated survivors to for additional support? So if you don't mind answering this poll, selecting yes, no, or we're working on it, we'd love to see where you're at with this. It looks like it's a mix. So it looks like some folks said yes, they do have some places they are referring folks to that are specific for folks who are incarcerated. Some people said that they don't right now. And a lot of you said that you're working on it. That's really fantastic to hear that you're working on it. Some organizations that tend to be good to look for are legal organizations. A lot of folks that are incarcerated have lots of questions about their legal rights, doing cases against maybe a perpetrator, things like that, oftentimes that are a bit beyond what a rape crisis center is able to answer. So it's really important, again, that if you do have legal resources, that you are working with maybe local lawyers in your area that take pro bono cases, things like that, but make sure that they work with folks who are currently incarcerated. Other support agencies that people have been able to connect survivors to are LGBTI specific organizations. That's always been really helpful. Also, reentry services can be really helpful for folks, especially if you're working with a local county jail. So those are all different places to look into making a referral list to build on your referral list. All right, so let's talk about coping skills. So just like with providing referrals and needing to change those a little bit, our coping skills that we provide to survivors also need to change a little bit if they're inside detention. And we've found that coping skills that require little or no extra materials and that can be done without attracting attention are some of the best and safest options for survivors who are behind bars. Of course, it's always best practice to talk through any coping strategies that a survivor is already using and to see if you can build upon those. While we always encourage survivors to use skills that they're already practicing, as advocates, we also sometimes offer up coping skills that may be new to a survivor. Again, it's always important to remember that we're not advising a survivor on how to heal, but rather offering out and sharing ideas on healing. Things like progressive muscle relaxation, journaling, and mindfulness can all be powerful coping skills for a survivor behind bars. Progressive muscle relaxation, or PMR for folks that are not familiar with it, is just an exercise that helps relax your mind and body by progressively tensing and relaxing muscle groups throughout your entire body. And we have created a handout on this, which you can kind of see on this slide, although it's a little bit small, but we'll be attaching that handout in the follow-up email. It's also in the handout section of this webinar if you want to check it out and share it with your clients. Mindfulness can also be a very useful coping skill. I do encourage you, however, to make sure you're walking through any mindfulness techniques with your clients as they may be a new skill for them. Journaling also can be a great tool to offer out, and there are a variety of different prompts you can use to help survivors start journaling if they're having trouble getting started. If survivors are interested in journaling but are worried about confidentiality or someone reading their journal, you can always suggest that the survivor tear up their writing and throw it in different trash bins to make sure their journals are never read, but that they still have that opportunity to really get out what's on their mind. So some different prompts that you can use or someone can use journaling for as a way to process trauma, an outlet to say everything they wish they could say to their abuser, a way to think about obstacles to being safe and planning around those challenges, or even just writing down positive affirmations. So there's a lot of options that folks have if journaling feels right for them. So just a quick question to you all. Are there other coping mechanisms that you've offered out to incarcerated survivors that have gone over really well with the survivors you worked with? Again, if you want to use the chat box or the questions pane, we'd love to see different coping skills that you've been able to offer out to survivors. So it looks like some folks are still working on figuring out all the facilities in their area, connecting with reentry centers. That's really fantastic. In terms of coping skills, has anyone been able to? Great, thank you, Yesenia. So it sounds like just reminding folks that they can always call the hotline. So using the hotline as a skill or as a healing piece that can be really, really helpful. Yeah, you can remind them of your services, absolutely. Anything else that people have been able to offer out that has been particularly helpful for folks who are incarcerated? Thank you, Daniela. So it looks like one agency has been able to print out cell-friendly workouts for clients. That's really fantastic. And I love that you found something that is really, really specific to the detention setting, especially around something like exercise. I think that can be, telling a client to exercise can feel like something we do for clients who are in the community. So I think it's really fantastic that you've been able to find something that's so specific to the detention setting, as a lot of different exercises can feel inaccessible for someone who's incarcerated. So that's fantastic. So let's get talking about the specific services that you all may be able to provide to folks who are behind bars. And one of the most basic services that rape crisis centers provide is hotline services. And with some planning, hotline services can be a fantastic way to reach and provide support to survivors behind bars. As many of you know, survivors within CDCR facilities, as well as certain other county systems, can use their local rape crisis center, their hotline that's available there, on a free, unmonitored, and unrecorded phone from any phone within their facility. And as we spoke about in part 1 of the series, if you're working with a county jail or non-CDCR facility, it's very important to pay attention to how the hotline will logistically be set up and advertised within a facility, and to have a strong understanding of how it's going to work. While setting this up can be daunting, once it's in place, it can greatly benefit survivors so that they have a direct line to support. And we're going to explore some good practices when answering calls from correctional facilities, a lot of which mirror what you're already doing for community folks on your crisis line. And it can take a little while for people to trust your agency and that the services you're offering. So it's likely that it may take a little bit of time for your number to really be used to the full potential once it's even posted. So again, we're going to do another quick poll just to see where you're at with your hotline program. So if you've already set up a hotline services with your facility, maybe you have more than one facility, that's totally fine. How often would you say you get hotline calls from incarcerated survivor? So please take a minute to select one of the following. And the options are at least once a week, at least once a month, at least once every 2 to 3 months, or almost never. So how often are you actually receiving hotline calls from folks behind bars? So thank you for responding. It looks like 69% of you receive a hotline call from someone who's incarcerated at least once a week. For about 20% of you, it sounds like you are getting calls at least once a month. And then for a few of you, you're not really getting any calls at all, maybe only once every 2 to 3 months or almost never. So again, this is why it's so important to make sure that your hotline services are being advertised appropriately, that the inmate population knows about your hotline services, because if you're not getting calls really almost ever, if you're only even getting calls of help once a month, that might actually be a sign that either the phone line isn't working or your services aren't being advertised appropriately. So that might be something to check in with your facility. For folks that are getting calls once a week, as we go through this section, I'd love to hear more about how those hotline calls have gone, and if there are any areas that you feel like your advocates have struggled with when answering these calls. Thank you for answering that poll. So let's talk about what these calls actually look like in the arc of a call. So a good place to start any call is simply by stating who you are and reiterating what your agency is for. So for example, you can say that this line is for survivors of sexual abuse and their loved ones. If possible, you also want to determine what specific facility the person is calling from at the beginning of a call, so you can give them accurate resources and referrals. You can do this simply by saying, do you mind if I ask where you are calling from, so I can be sure to give you information that best fits where you are. Again, many of you have multiple facilities in your service area, so this is going to be a really helpful question for you to ask. Once you're able to determine that the person is calling from a particular facility, it can be helpful to let that person know that the call might be cut off after a few minutes. And as we know, calls tend to be cut off about 15 minutes from calls that are coming from CDCR facilities. But if that happens, you can let that person know that they can always call you right back. You might also want to clarify that the call is non-recorded and confidential, of course, only if that is true for your line. And if it's not, you need to make sure that you're explaining that it is recorded or monitored. You also want to be very clear about the limits of your confidentiality, especially if they disclose threat to harm to themselves or others. You want to do all of that at the beginning of your call. For those who are just starting to work at a local jail, you want to remember that you are not the PREA reporting agency. So under PREA, all facilities must have an outside reporting agency and a way for survivors to contact them to make a report of sexual abuse or sexual harassment. Sometimes callers think that that is what your line is for, and this is why it's so important that you have a strong understanding of what the reporting process is for each facility, so you can help a survivor work through this process and connect them to the right resource. Calls where survivors are seeking just sort of general emotional support tend to be some of the most common calls that Rape Crisis Center tend to get from incarcerated survivors on their hotline. When people are calling for general emotional support, we can use those same skills that we use with folks in the community. First and foremost, we would want to remind survivors that it's not their fault that the assault happened. Sexual assault can be an incredibly isolating experience, and this is especially true for survivors in prison and jail. Inside a detention setting, talking about sexual abuse is often not welcome and is often dangerous, which is why having this confidential call is so needed. As advocates, we have the ability to reiterate to the caller that they are not alone and that healing is possible. You might be the first person this caller has opened up to about their assault. We can also normalize trauma reactions while being mindful that a prison and jail environment can be extremely triggering, as things like strip searches and the hyper-controlled environment may heighten someone's reactions post-assault. We can also offer coping skills, as we spoke about earlier, again, making sure that those skills can be used inside a detention setting. It can be helpful to ask what someone already has access to, as this is going to depend on an individual facility as well as the survivor's individual housing. A hotline call can be a great opportunity to walk through those coping skills with the survivor so they have a chance to practice it while you're on the phone with them. You can also provide resources. And again, this is where your research is going to come in handy. So you already know what kind of mental health support or other programming is available and what resources in the outside community are available to those who are inside. Survivors who are incarcerated know themselves and their resources best, and they are a wealth of knowledge. So even if you're not sure how to help someone, we can help them process through and talk out what they're experiencing. Also, as we mentioned earlier, when providing resources, it's always important that you are wary of providing referrals that are not applicable or safe for that person. When you're working with someone who's thinking about reporting sexual abuse or sexual harassment and has not done so yet, you can help walk them through this process and talk through what it would look like if they did make a report. If the person is feeling like, yes, they want to go forward with a report, I generally ask them if there's any staff that they feel particularly comfortable talking with and have them start the report through that person. If there is no staff that they trust and they still want to make a report, you can refer them to the outside reporting agency, which is usually available through a specific phone line or mailing address. Again, this is why it's so important that you know that information up front. Survivors will call who have already made a PREA report as well, and they may be frustrated with the process of investigation, still feel unsafe, or are devastated that their case was determined to be unfounded. When we get calls like this, we can echo what we do in the community if someone has made a police report and that they're experiencing issues around the criminal justice process. First and foremost, you always want to start with providing emotional support, which will often hold a strong component of validating their frustrations with the system. We know that the reporting process is not perfect and that frequently things are not investigated at a level that we would like. And it's okay to voice that sentiment to a client. Even if we've built a wonderful working relationship with facility staff, we want to make sure we're never defending staff to the survivor. If a survivor is disclosing issues with the system or a particular officer, we want to reflect back what is happening to them is not okay. Sometimes we can help a survivor explore other avenues of reporting or receiving assistance. And this often has to be creative, as a survivor will have likely already tried most general options. Depending on your agency's policies, you may also be able to offer advocacy to the survivor and offering to assist them in this process, which we're going to talk more about later. When someone calls about their PREA report, we want to make sure we have a strong understanding of the PREA standards and someone's rights, so we can explain to that survivor what they are. And also we want to feel prepared and knowledgeable about the facility itself, so we can help a survivor navigate this difficult process. I think one of the most common fears that advocates, especially new volunteer advocates on our hotlines, have is answering a support line call when a client is suicidal. So while these calls can be scary, folks who are calling a support line are calling for a reason and are often willing to plan for safety. We know that while suicidal calls are rare, we want you and your advocates to feel prepared to receive these types of calls. So if you do receive a call like this, we want to closely follow your agency's policy and procedures regarding assessment and reporting to authorities. Make sure you know your agency's protocol regarding suicide so that you can adapt it for calls that come from correctional facilities. If a caller refuses or is unable to agree to plan to keep themselves safe, and you've used your agency's protocol to assess that confidentiality does indeed need to be broken to keep that caller safe, a call needs to be made to the correctional facility. This can be made to a number of different people, including a PREA compliance manager, the investigative services unit, or even a watch commander who is available 24/7 if you're unable to get in touch with your usual contacts. It can be helpful to make sure these numbers are easily accessible so that if you do need them, you're not scrambling to find a phone number. Once you contact facility staff about a client, the facility will then refer that person to medical and mental health, will often interview that client, and may put that person under observation or on suicide watch. Suicide watch ranges from 15-minute checks to removal from a cell, depending on the assessment of risk. After you've contacted a facility about a suicide risk, it can always be helpful to follow up with the facility to see what steps they have undertaken, so you know how to proceed in terms of following up with that client and ensuring that the client is in as safe as possible place. Another type of call you might get is an off-topic caller. So whether we're working a support line that's for folks in the community or for folks that are in detention, unfortunately, these are types of calls that we get. Sometimes they're off-topic and sometimes they're inappropriate. We want to be mindful, however, that someone might not disclose sexual abuse right away on the phone, especially as phones within detention settings are often in public places, such as on the yard. And just because someone does not directly say that they are a survivor doesn't mean that they're intentionally misusing the hotline. What we can do if someone is not bringing up any type of sexual abuse or sexual harassment is gently remind the caller about the purpose of your hotline and ask them if that's why they're calling today. You can also offer to go over coping skills. And if the caller still remains off topic, remind them again what the call is for and let them know that they can call back if they have any concerns in regards to sexual abuse or sexual harassment, and then you can end the call. You might also get calls that are inappropriate, where a caller is using derogatory language or is trying to seek sexual gratification by calling. If you're feeling like a caller is being inappropriate, it's very important to set boundaries as soon as you can. It's okay to interrupt someone and to say something like, I'm not comfortable with the language you're using. Can you focus more on how you're feeling? A caller might just be testing to see if you're a safe person to talk to or hasn't had someone keep and set boundaries with them. So once boundaries are stated and a client agrees to follow them, you can proceed with a call. However, if a client refuses to stick to boundaries and continues to be inappropriate, you can absolutely end the call. I usually say something like, as you're not able to respect my boundaries right now, I'm going to have to end the call. And you do not need to wait for a response to hang up. It can be very frustrating to get an off-topic or inappropriate call. But just like when we get these from folks in the community, we want to be as professional and clear as possible. And as always, it can be helpful to check in with your team as well, so you can process through these difficult calls. So now that we've covered different types of calls and how to start a call, it can be also important to review how you're going to wrap up a call. So as we're ending a call, you want to make sure you're summarizing what you spoke to the client about and reviewing any safety plans you may have made. You're also going to want to offer follow-up services, which is going to look very different than it would for someone in the community. As we cannot just call someone up who's incarcerated, a follow-up plan might be having the survivor call the support line back, or it might include letter writing or in-person services, depending on what your agency provides. Letter correspondence is the easiest way to provide follow-up to incarcerated survivor. And on the call, you can give a survivor your agency's mailing address to write to you directly, or you can offer to send them a letter. If you're offering to send them a letter, be sure to ask for consent to send that mail. You do not want to send someone something if you do not have their direct permission to do so. If they did give you this permission, let them know that you're going to need more information for them so that that mail gets to them. To send a piece of mail to someone who's incarcerated, you're going to need their full legal name, their inmate number or booking number, their housing unit, as well as the facility address. If you're going to be providing in-person services, make sure you get their permission to set that up, and also make sure to be as realistic as possible about the timing on that. Especially with COVID-19, a lot of in-person services have stopped, so make sure you're being clear about that. If your agency has offered to assist in advocacy on behalf of that client, and you're going to be contacting someone on their behalf, you want to, again, make sure you're getting their permission to do so, filling out a release of information if needed, and also planning for how you're going to let the survivor know what happened and keep them updated with those advocacy efforts. Of course, it can be difficult to fit all of this into a time-limited phone call, but make sure that the survivor knows that they can always give you a call back, and make sure that they have your information so that they can continue to get care. And while it can be stressful to get these calls, know that just by listening to a survivor and being a safe person to talk to, that you're really offering something to them that they may have never had access to before, and that you are making a difference.
We're going to go ahead and get started on written correspondence. So as many of you know, letters are one of the most common ways that folks behind bars, especially those in prison, have contact with the outside world. And now with the COVID-19 restrictions, letter writing is even more important since many of you can't enter the facility and many folks are not able to see their friends and family in person. And we know that letter writing can be daunting, but it can be really a vital way for survivors to receive ongoing long-term follow-up care and emotional support. So let's go ahead and dive into the basics of letter writing. Oh, actually, we do have a quick poll here as well. So if you already set up your letter writing program at each of your facility, how often would you say that you're receiving letters from incarcerated survivors? So at least once a week, at least once a month, 2 to 3 months, almost never. All right, so it looks like it's about 33% of folks are getting letters at least once a week or once a month, and about 11% are receiving letters about 2 to 3 months, every 2 to 3 months, and 22% say almost never. So there could be a multitude of reasons. I think Chris mentioned earlier that maybe folks just don't know that letter correspondence is an option for them. Maybe they're not seeing the posters that are up in the facility. It could be that some folks are worried about having their letters read, so they're not aware of whether those letters will be kept confidential. And it could just be that they're working up the courage to write a letter to you. So it's always worth making sure that your posters are up in several different places to make sure that folks are aware that yes, in fact, they can write to you in a confidential manner. So we're going to go ahead and talk a little bit about filing and tracking decisions. So as we talked about in part 1 of setting up services, it's super important to have a system in place before you offer a service. And so as letter writing is often a service that isn't already provided by many of our RCCs, it may take some additional thought to help with the logistics of starting a letter correspondence program. So a couple questions you can ask yourself are, where will letters be stored and for how long? How will you actually handle the letters you receive and your responses so that they are secure, confidential, and safe? If your agency uses a database, there may be ways to add letters there. And you also want to consider how you're going to track letters for your monthly reporting. And with COVID-19, you may need to think of additional ways that letters will be sorted and read if many of your staff are working remotely. So we really encourage you to look at our webinar on altering your services to COVID-19, or to contact us if you need some tips on how to be storing those letters and how often you're checking for letters at your physical office. And also feel free to ask any questions in the questions pane as I go along here as well. So what can we expect with letters? Letters can vary widely in length. Some letters may be a single sentence, like please send me a list of your services, or please add me to your mailing list. Other letters may stretch over many, many pages and could be sort of an act of processing or self-soothing for that survivor. Many letters may include legal documents and other paperwork, so folks may be asking you to store those letters and that legal documentation, so be clear about your ability to do that or not. Some letters may not directly disclose sexual abuse or sexual harassment at all. Others may allude to it, but not state it directly. Others may hide it in the middle of a letter that has multiple topics. And some letters may immediately disclose that sexual assault has taken place, but may go ahead and put an emphasis on legal remedies rather than emotional support. You may get letters where the writer's handwriting is difficult to read and understand. And you may also get a letter that's in a different language from English, and it can be super important to plan for the translation of the letter that you received as well as your response to the survivor. So we really encourage folks to stay alert for trends and experiences that might be issues that you want to raise to your contact at a facility. So when you get a letter, you want to go ahead and treat it as you would a hotline call. You are there to respond and provide emotional support and safety planning. And as such, you want to make sure you respond in as timely a manner as possible. And really best practice is to write back within 2 business days of receiving a letter. We know that some folks may not have the capacity to do so just because of working from home. So if that change has happened, go ahead and inform your clients of that if you haven't already. And generally, response letters should be 1 to 2 pages, even if the survivor writes several pages to you. And we suggest that all of your responses should be typed, maybe using size 14 font, and a type of font that's really easy to read would be best. And of course, when you address the letter, you'll want to make sure to put the survivor's full legal first and last name, their CDCR or booking number, and then the facility name and their mailing address. But oftentimes survivors may use a nickname or a name that's different than their legal name. So you'll still want to use their legal name on the outside of the envelope just to make sure that it does arrive to them efficiently. But on the letter itself, go ahead and address the person's chosen name just to validate, really validate that. You want to make sure that your response letter is able to be read by people who have a wide range of reading abilities. You really never know the education level of the survivors that you're working with. So a good practice is to write at about a 6th grade reading level and to be as clear and concise as possible in your writing. It can also be helpful if the advocate who responds is consistent through the work with that survivor. So if possible, try to keep the same advocate with the same survivor, just as you might with a survivor in the community who's seeking in-person services. So as many of you know, CDCR has agreed to treat mail that is marked with evidence code 1035.4 on the outer envelope as confidential mail. So this means that all letters with this code on the outside are not read by staff and are opened only in the presence of the survivor. And this is really so that they're checking for any type of contraband. In order to protect your clients and provide confidential advocacy, be sure to use a label we provided with evidence code 1035.4 on all envelopes that you send to incarcerated survivors in specifically CDCR facilities, and also encourage them to write this code on the letter if they respond to you. And we'll go ahead and send the labels to you in a follow-up email if you don't have the label already. And as far as working with local county jails, it's super important to establish how letters will be kept confidential, as the evidence code applies to all CDCR facilities, but it doesn't apply to all county jails. So whatever you decide with your jail, you should include it in the MOU that you have with them and update it if necessary, and make sure that survivors know how to keep mail they're sending to you confidential. So once you have an understanding of the protocols and what a response letter should look like, your next step may be to screen the letter. This way you can set your priorities and really know how to budget your time to read and respond to those letters. So as soon as you receive a letter, you can read it to try to assess what the survivor's needs are. And from there, you can start thinking about what your response might be depending on what the person is writing about. One thing that's helpful for me is thinking about the level of safety and the level of crisis the person is in based on what they're writing in their letter. And then determine what type of abuse that person is describing and other issues that they have brought up. And from this assessment, you can start to think about what resources to connect them to and how to do so. Those things might be the meat of the letter, but you also want to develop a rapport with the person who's writing to you, as really the goal in letter writing is to provide ongoing care through the letters. We want to make sure that the first letter that you send out to a survivor, they are in fact wanting to respond to you and continue that correspondence. And as many of you know, folks behind bars are often transferred, and this can really create a lot of anxiety for them about their safety and contributes to a generalized feeling of not having control over their lives. And because transfers can happen randomly or in response to a safety concern of the survivor or as a form of punishment, it's always best practice to run the client's ID number through the inmate locator before addressing your envelope. And this database is updated daily. There are also inmate locators for all facilities. So no matter if your client's in CDCR custody, a local jail, or a federal facility, there should be a way for you to locate their location. And so something that's important for folks to know is that while JDI and CalCasa do not provide intensive ongoing letter correspondence with survivors, something that JDI does do is send a first response packet to people when they make their first contact with them. And oftentimes we'll also send the survivor to the RCC in their service area so that they can continue to correspond with the PREA advocate in their service area. So we really encourage RCCs to create a packet that can be sent to survivors as well. A first response packet should include absolutely a letter back to the survivor, a list of your services. It can include things like information about trauma and coping inside, as well as someone's rights under PREA. And if applicable, it could also include a release of information and information on how the person can continue to receive support from your agency, such as through the hotline. You can also include information on how the survivor can reach another RCC if they're ever transferred or if they're not within your service area. And of course, you can always reach out to us if you have trouble finding which RCC is in their service area. You may have already created materials that you provide to survivors in the community. So it would be important to go ahead and adapt those materials to fit the needs of survivors in detention. And so with all that being said, this doesn't mean that not to include an individualized response to the client. It's just additional information that you can send them alongside that letter. And something that we really encourage folks to stay away from is using pre-written templates to respond to letters, as you really want to make sure that survivors are receiving customized letters to what they've written to you. But that being said, you may include similar sentences and letters to different clients. So in your response letter to a survivor, the introductory paragraph can, for example, always start by thanking them for contacting your agency. You can also describe what your agency can and cannot do to support them and to advocate for them. It can be helpful to let a writer know what you can do in terms of copying or storing documents for them, as well as the limits to your confidentiality and the amount of advocacy that you're able to do for them. So why do survivors behind bars usually reach out to RCCs? Survivors behind bars often reach out for general emotional support. And it's important not to underestimate the power of emotional support, even if no other support is available. It really can be enough to tell someone you believe them and that it's not their fault. Statements providing emotional support should really be peppered throughout a response letter. And let the survivor know that what happened to them was not their fault, normalize their trauma responses, and offer some ideas for coping skills around any trauma reactions they may have mentioned. And as I mentioned, you may be able to send materials like the progressive muscle relaxation handout that was up on one of Chris's slides, or another worksheet on, for example, sleep hygiene, just as you might share with any survivors in the community. But also, again, make sure that you're modifying your materials to be applicable in a detention setting, and that you're providing explanations of the materials in your response letter. Remember, you are the resource for this survivor. So oftentimes referring them to mental health care in the facility is not appropriate due to any mistrust that they may feel towards folks that are working within that facility, and could be a lack of emotional support that they receive from them. And so again, oftentimes you are the only ongoing support around sexual abuse and trauma that is available to a survivor. So if a letter is about ongoing abuse, you again want to provide emotional support and validate the feelings and reactions of the survivor. And you also want to explain the reporting process, and if possible, provide appropriate resources. You also want to make it clear that they know what will be best for themselves and that you are there to process with them whether or not they want to go forward with making a report. Other survivors may write asking for advocacy on their behalf. So if you're unsure of your ability to provide institutional advocacy, make sure to talk with your team and your supervisor so you can be clear about this in your response to a survivor. You can absolutely validate any frustrations with the system that they may be expressing, explain their rights under PREA and how to make a PREA report. And if you will be providing advocacy on their behalf, you may need to write back with the release of information so that you can speak with your contact at the facility. And if you do this, it's super important to let the survivor know the limitations of what you can do and any possible repercussions of your advocacy efforts. Retaliation isn't allowed in facilities, but oftentimes it's still something that survivors experience. And just like with hotline calls, if a survivor expresses any kind of suicidal ideation, you can help the survivor safety plan. And also make sure that you're referring to your agency's policies, professional standards, and California state guidelines to determine whether it is necessary to break confidentiality. And if needed, you may need to break confidentiality to follow your agency's policy and call your contact at the facility. But how you respond to such a letter should always be on a case-by-case basis. And in every case, advocates should respond in a way that ensures your client's safety while minimizing any violation of that person's privacy. Whether or not you decide confidentiality needs to be broken, you want to respond to the survivor's letter and make sure your letter outlines your limits on confidentiality, provide strong emotional support, and a basic safety plan for that person. Something that you get on hotline calls that you may also get with letters is that you'll get off-topic letters. It's important that regardless of this, we remain professional as we set clear boundaries and explain the scope of our services. Types of off-topic letters may include letters where people are asking for legal help that isn't related to their sexual abuse. There could be inappropriate letters and letters where it seems the person is just wanting to talk. And so with all off-topic letters, it's important to remember that even if the person does not disclose sexual abuse, it doesn't mean that they're not a survivor. They may just be testing to see if you respond or if your service is being safe to them. So you still want to respond to all of those letters that you receive, even if it is just to explain your services and what the boundaries of your work are. So let's go ahead and talk through one example of a letter. As one of the most common letters you may receive will be one like this, where the person is seeking some a general emotional support. So I'll go ahead and read it out loud, and as you're reading it as well, please feel free to add any ideas of some things you may write back to the person if you receive this letter, and so you can go ahead and put your responses in the questions pane. So this letter says, "Dear Advocate, I saw your info in a resource guide. I didn't have anyone else to talk to about this, so I thought I'd try writing to you. A few months ago, something happened here with one of the other inmates. He's gone now, but I feel so violated and dirty. I just feel like somehow this is my fault. I have been having nightmares and I haven't slept well since it happened. I just want to feel normal again." So let's take a moment to come up with a phrase or a sentence or two that you would respond with in a letter. Could be emotional validation, it could be a resource, it could be a way to cope, any ways that you could offer up recovery and healing for this survivor. So I'll just go ahead and throw something out there. I think something that we mentioned earlier in the webinar is providing some resources around sleep hygiene for the survivor who's sharing that they are having nightmares and haven't been able to sleep well since then. Certainly validate that this was not their fault. That although they feel violated and dirty, that this isn't something that isn't inherent to their being. They absolutely are not dirty after experiencing sexual abuse. This is something that many survivors may feel after a sexual assault. Yeah, so I'll let folks respond as they think of things, and then I'll go ahead and pass it on to Chris to talk about forensic exam accompaniment.
Thank you, Marcella. So another core service that rape crisis centers provide is forensic exam accompaniment. So let's talk through some things that we have in our control so we can make forensic exam accompaniments as helpful as possible to survivors who are incarcerated. So as we all know, it is best practice for a correctional facility to work directly with forensic nurses to determine if a survivor does need a forensic exam. And they really should be bringing people to get these exams if an assault happened within the last 120 hours. Whether or not that assault happened in their facility or out in the community or at a different facility. If it was in the last 120 hours, they really should be bringing folks in for an exam. And as we mentioned in part 1 of this webinar series, you can review your facility's coordinated response plan to make sure that contacting your agency for accompaniment is included as part of this process. Before an exam comes up, you're also going to want to make sure you determine where your facilities are taking survivors to get an exam. So for most, it's going to be a local hospital that the prison or jail has a contract with, but in some rare cases, the prison will transport the survivor to a hospital that is outside of your service area. This is another reason to make sure you're aware of the procedures, so you can really help to ensure that your client does receive care from the corresponding rape crisis center. At other prisons, the exams are actually done on site within the facility itself. If this is the case, be sure that your staff have clearance to enter the facility so that you can accompany the survivor if it happens inside. It's also helpful to have as much information on all of this as possible so that you can help educate survivors who may call your hotline about this process and may have questions about it. You also want to make sure that you're preparing advocates who are responding both to exams and hotline calls. Many of us also have materials and information that we give survivors at the end of a forensic exam. And these materials need to be altered for someone who is incarcerated. It's important to work with your facility to see what a survivor can and cannot be allowed to bring back with them, as things like clothing and hygiene products that are often given out at the end of a forensic exam are usually not allowed within a facility. Also, some survivors do not feel comfortable bringing back worksheets or information that clearly identifies them as having worked with the Rape Crisis Center. And what some centers have done is created PREA-specific business information, business cards or pamphlets, things like that, where the information about sexual abuse is a little more discreet or has some sort of cover over it so that they can keep it closer and it isn't so overt. These are just a few things to keep in mind when preparing to provide a forensic exam accompaniment to a survivor who's behind bars. So what do one of these exams actually look like? Generally, a survivor is going to be taken to an exam site inside of a transport vehicle, usually accompanied by 2 or more officers. Many times the officers who are accompanying a survivor to a sexual assault forensic exam have never even been to one of these exams before and do not know what they're going to entail. Once they arrive at the hospital, the survivor will likely be in handcuffs, waist chains, and ankle cuffs, and as well as their prison or jail uniform. So if possible, if you meet survivors in the waiting room, especially if your waiting room has a lot of people in it, if you're in a large hospital, things like that, it can be really helpful to get a survivor seated comfortably and to get them a blanket so that they can cover their shackles to give them a little bit of privacy. With COVID-19, rape crisis centers are often doing remote accompaniment for forensic exams. And so it's also really important to have a system set up in place for how you're going to be connected to the survivor to begin this process as well. Once you arrive at a forensic exam site, you're going to want to make sure that everyone there is on the same page. It's always best practice not only to introduce yourself to the survivor, but also to any officers present and the nurse, so everyone has an understanding of who you are and your right to be there with the survivor. Officers may be wary of your presence, and if needed, you can always cite the PREA standards and your facility's coordinated response to help back up your right to be there. Just like with survivors in the community, you're going to want to explain who you are and your role. Even if someone has already explained it, the best person to explain the benefit of an advocate is the advocate themselves. You also can let the survivor know that what you do, a little bit about your organization, and remind them that your rape crisis center is separate from the jail or prison. Let them know that you're an outside person just there for them to help them through this process. You're going to also want to be very clear about your limits of confidentiality. It's always important to let the survivor know who can be within the exam room while you're there as well. Let them know that you can be there for the entirety of the exam, just pieces of it, or you can wait to talk to them until it's over. Let them know that they're in control. This is best practice even if the survivor does not want you in the exam room during the exam itself and asks you to wait. It is best practice that you're still waiting even if they say they don't want you in the exam, so that you can check in with them when it's over. Not only does the survivor have control over whether or not you're in the room with them, they also get to decide what pieces of the exam they do and do not want to do. Like with all survivors, during the exam, the more power you can give to someone over their decisions, the better. When someone is incarcerated, there might be more pressure from a nurse or an officer for that person to do or not to do parts of the exam or to give pieces of information they may not be comfortable sharing. There is no reason that a survivor should ever be forced to do a piece of the exam that they're not comfortable with. It's also very important that you remind them of this and help advocate for them if anyone is pushing them to do pieces that they're not comfortable with. Again, confidentiality is so important, and it's incredibly important in our work with survivors who are incarcerated. With folks who are incarcerated, sometimes we have to be a little bit creative to create a sense of privacy and maintain confidentiality. It is likely that at least one officer will have to remain within at least eyesight of that survivor during the full exam. This means that you do not have the same level of privacy and confidentiality that you normally do. That being said, your conversation with survivors who are incarcerated during the exam are still confidential. What a survivor shares with you, excluding, of course, child abuse and imminent threats to self or others, is protected information and should not be shared without a specific release of information. Remember that you're there for the survivor. And just like when family members or friends who are in the exam room with you during an exam accompaniment with a community survivor, your primary concern is the survivor themselves. And this is the same when you're working with someone who's incarcerated. Officers might ask you questions or want you to tell them something that a survivor told you, and you can politely remind them that what the survivor tells you is confidential and that you're not able to share that information. When you're starting an exam, remember, as always, that you need to introduce yourself to everyone. When you're working with someone in a medical setting, especially, you want to make sure that you're using that survivor's preferred name, the name that feels most comfortable to that person, as oftentimes folks will only have their legal name on paperwork, and officers might only use that person's last name. So be sure to use the name that feels most comfortable to that survivor, even if others are using different names for them. It's also best practice to ask what pronouns your client uses and to make sure to use the correct pronouns for your client. In thinking about where to sit, if a survivor does want you in the room during the entirety of the exam, it can be helpful to be where you can have a confidential conversation with them while being able to give them the privacy they deserve. So if possible, and always with the consent of the survivor, a great place to sit is by their side, up by their head, especially if they're on that exam table. This allows you to have a closer conversation with them, and it also allows the person more privacy if a genital exam is done while you're in the room. Again, with COVID-19, you may have to alter where you are, but it's important to have a plan in place. During the exam, just like with any survivor, you can talk about a wide variety of topics with your survivor. Your main role is as an advocate to be there, to believe the survivor, and to continually remind them that it's not their fault for what happened. This is especially important for someone who's incarcerated, as there's often an added layer of blame or acceptance towards sexual violence behind bars. You're also going to want to be there to explain anything that the nurse is doing, especially if the survivor seems confused. While we know that what is done during an exam can be really traumatizing, it can be helpful if the advocate is able to be there and really walk through that process with the survivor. We also know that doing an exam on someone who is handcuffed and has shackles on them is not trauma-informed. However, as advocates, we do not have the authority to ask them to be moved or removed. Only the nurse can ask for them to be removed or moved, and they will ask officers if they need this to be done to do their exam properly. We know that exams can be long, and to get through the difficult process, you may end up talking about things that are not directly related to the assault, things like the survivor's family or places that make them feel safest. And however, one thing that you should never engage in conversation about or ever ask about is why the survivor you're working with is incarcerated. Knowing why someone is incarcerated may make you feel biased against that person or treat them differently. Even if someone brings it up, a survivor may tell you, an officer may want to tell you, it's important that you remind them that you're there because of what just happened to them and that you're there to help them in their healing process, that no one, no matter what crime they may have committed, deserves to be assaulted. Unfortunately, even when we're having a positive interaction with a survivor, sometimes officers or nurses will say things that you do not agree with or are problematic. And while it's always important to be professional and to maintain your relationships with both the nurses and facility staff, we do want to step up and make sure we address any problematic language. Sometimes an officer will try to invalidate a survivor's story. Remember that you're not an investigator and that you're there for the survivor, and you can always remind the officers of your role. Just like it's necessary to educate your advocates on working with incarcerated survivors, nurses as well may have never worked with someone who's incarcerated and may benefit from training. And while it's not appropriate to do this during an exam, you may have to do some bias control. During the exam, you might also find out that a procedure or process was not followed correctly following the report of sexual abuse that the survivor made. So for example, a survivor may disclose to you that they tried to report the assault multiple times, but that a particular officer would not or refuse to take the report. If this is the case, with the survivor's permission, this may be an opportunity for you to talk to the PREA compliance manager or other contact at the facility about this, again, with the survivor's permission. Let's talk a little bit about follow-up after a forensic exam. It's very important to share with survivors all the different ways that they can stay in contact with your center to continue to receive care and services even after the exam is over. The goal during the forensic exam is for you to have developed a good enough rapport with the survivor that they would like to continue to receive services. If they would like to reach out to your center, you're going to want to make sure the survivor knows when they're back at the facility, that they can always call your hotline and how they can do so and what level of confidentiality there is for those calls. You can also let them know that they can reach your center by writing, being sure to give the survivor your mailing address. If you offer in-person services, be sure to let the survivor know how they can access those as well. Additionally, part of the PREA standards require that an advocate be allowed to accompany survivors during investigative interviews. If this is something your organization allows, be sure to let the survivor know how you can be there during this as well. After an exam, sometimes the survivor is asked to follow up with a doctor for further medication or for follow-up testing dates. Well, when a survivor is in the community, we might work with them on where they can get those services and maybe even go with them to those services. For someone who's incarcerated, we're going to have to work with medical staff at the facility to make sure they're getting access to this needed care. And again, under PREA, they should be allowed this medical care free post-assault. If a survivor does want you to advocate on their behalf or you to reach out to the facility to help set up follow-up services for them, you're going to want to make sure to complete a release of information. As prisoners are often transferred to different facilities within the system, as Marcella mentioned, it's going to be important to be aware of the different rape crisis centers that serve different facilities in case your client is transferred. If a client does want to make sure they get continued care once they're transferred, this is a great opportunity to complete a release of information in case that transfer occurs. So when you're having a survivor complete a release of information, you're going to want to allow space for your client to name specific individuals that they do give permission for you to discuss their situation with. Most of the time, this is just going to be the PREA compliance manager at your facility or the local advocate at a neighboring rape crisis center. When filling out a release of information with a client, make sure you explain why you're completing out the form and what it means. I always offer to read it out loud and to summarize what it's saying for the client, especially because a lot of releases of information are written in very legal language that can be difficult to understand. This is just an example of release of information on the slide, but again, we encourage you to look at your own release of information and maybe to think about adapting it specifically for folks who are incarcerated. So just a quick poll for you all. We're curious to hear about how often your agency is able to provide follow-up services post-forensic exam to survivors who are incarcerated. So we'd love for you to take a minute just to answer this poll and let us know how often you actually are able to follow up with a survivor who's incarcerated after a forensic exam is done. So please select one of the following: almost always, about half the time, almost never, or you're not quite sure. So it looks actually pretty evenly split. So about a third of you said almost always, another third of you said about half the time, and some of you said almost never. So I would be curious if you answered almost never, kind of why you think that is, and kind of maybe to think through some strategies about how to increase follow-up services provided to survivors post-forensic exam. Again, I think we really want to be mindful during forensic exams that we are building a strong rapport with the survivors we're working with, make them feel as comfortable as possible, and really encourage that survivor to continue services with your agency, even if it's just letters back and forth that you do with someone, or that they are going to call your hotline after the forensic exam. Again, if you are seeing that you're thinking that most of the time that they're not able to access your services, that might be something to look into. And thank you for answering that poll. So let's talk a little bit about advocacy. A large role that advocates provide is, well, frankly, is advocacy, right? So advocacy on behalf of a survivor can be especially important for clients who are incarcerated, as their voices are often not heard. Also, in a prison or jail setting, the voices of outsiders, such as an advocate from a rape crisis center, are often heard louder than the voices of those who are inside. And you can really provide advocacy on behalf of survivors that call your hotline, write your agency letters, that see you at forensic exams, or for clients that you see in person. So while we all strongly believe that empowering survivors to make their own actions and choices is important, speaking up on behalf of a survivor who has already tried several remedies and who is still not being heard, this may be a place where we can really provide really tangible support. There are many reasons you may be asked to provide advocacy on behalf of an incarcerated survivor, or where they might bring something up and you're able to offer some type of advocacy. One of the most obvious times we may be able to speak up on behalf of a client is if they feel that their immediate safety is at risk. Perhaps they've tried to report abuse several times and know that they have to see the abuser in the near future and are worried about their safety. Another issue we may be able to address is housing. If a survivor is letting you know that their housing is making them feel unsafe, that they need to be on single cell status to continue to heal and not be triggered, or that they're in some type of need of protective custody, these are all things that we may be able to bring up with the facility. Survivors that we work with may also contact advocates about issues they've had with the reporting process, the investigation, or the way that they received care after the abuse. These are all things that can be brought up to a PCM or even to an outside oversight agency that we're going to talk about later. When a survivor is facing retaliation for reporting or is facing ongoing harassment, this is another time we may be able to advocate on behalf of our clients. Medical needs are also something that often come up in our conversations. Clients may need follow-up STI testing, as I mentioned earlier, or may be facing issues getting their regular medication. And while we are not medical professionals, we may be able to give a secondary voice to their concerns. So let's chat a little bit about some times that you've been able to provide advocacy on behalf of clients behind bars. So if you have been able to call your contact at the facility about a client or about a situation, what were some of these situations that you were able to help a client or to add an additional voice to a client's concerns with the facility or with an outside reporting agency for someone who's incarcerated? If folks don't mind taking a minute to respond in the chat box, again, any time that you've been able to advocate on behalf of your incarcerated client. Looks like one person here is saying that they've spoken to behavioral health. That's fantastic. Yeah, if someone's having issues getting mental health care while they're in a facility and is interested in that, or maybe they are seeing a therapist while they're incarcerated but aren't getting the care that they need, or having trouble with their medications. This is why having such a good relationship with mental health at a facility can be really helpful. So it's fantastic that you've been able to do that. Thank you for sharing that. Yeah, if other folks have other times or folks that they've been able to advocate to on behalf of their client, love to see that. And I'll share it with the rest of the folks that are attending this training. But let's talk a little bit about what this advocacy might look like. Sometimes we really have to parse out what kind of advocacy we really can do on behalf of a survivor. Sometimes they're asking you to contact someone like the mayor or the governor on their behalf. But what their main concern really is around their housing and maybe maintaining single cell status. This is why it's so important for us to have a strong understanding of what the survivor hopes to gain as a result of our advocacy efforts. So in this example, it might make most sense for us to actually talk to the PCM about their concerns, as they would have more control over a survivor's movement and housing than someone like the governor. When we're working on behalf of a survivor, we want to be very clear about what we're doing. You're going to need to explain what you're going to say, to whom, and what the possible outcomes might be. You will want to make sure that you're being honest and be very careful not to overpromise anything. This is going to be especially important as it can be hard for a survivor not to get excited when you're helping them in this way. While your word often carries more weight at a facility than the word of those who are incarcerated, this does not mean that you saying something will change something for the better for the survivor. And it's important that your survivors know this. You're also going to want to make sure you're being truthful. So if you said you were going to talk to the PCM that week, that you actually do so and follow up with the survivor about that conversation so that they know what's going on. Always weigh the pros and cons of advocacy with the survivor. While retaliation is not allowed, it doesn't mean that it's not a very real and common thing that many survivors behind bars face, especially when attention is brought to issues that are happening inside a facility. Always let your clients know that there may be unintended negative results as a result of your advocacy, and talk through potential safety plans to help this if this happens. As always, when you're going to advocate on behalf of a survivor, make sure you're using a release of information. You can always send a release of information via letter. You can also fill one out with that person during a forensic exam, as I mentioned earlier. And if necessary, you can fill one out with a client while you're on the phone with them. But it is very important that you have this documented and their documented permission to do so. When you're providing advocacy on behalf of a client, it's going to be most usually in the form of talking to your main contact at the facility, such as the PREA compliance manager, the head of medical, or maybe even the head of mental health at the facility. And again, this is where having a strong relationship with the facility is going to come into play. The better your relationship is with different staff at the facility, the more your opinion and words are going to be heard. This means that you're going to need to be strategic about who you talk to about what issues, how often you go to your contacts about advocacy concerns, and more importantly, how you actually word your concerns. You're always going to want to communicate in a professional manner, even when you're appalled by how your client is being treated. Unfortunately, when we're working with the system, it's important to be prepared for nothing at all to happen as a result of your efforts. However, it's important to stay grounded in these efforts. These systems move glacially, and even those in power at the facility level are beholden to those in power at the agency level. It's important to keep pushing for the level of care, dignity, and safety you know that all people are entitled to. And also important to avoid burning out because you feel like you aren't making the impact you expected to make. The ability to help even one person on the road to healing justifies our efforts. It's also very important that we're documenting any advocacy efforts, so you have a record of who you spoke to, what you said, and how many times you brought it up. Keeping this kind of documentation can be helpful in recognizing patterns of the concern at a particular facility and may help you if your facility is getting an audit and you're able to speak to an auditor about these patterns of concern. There may be times where advocating to a facility staff is not enough, and you feel that contacting an oversight body makes the most sense. So let's talk a little bit about oversight. Many detention facilities have oversight bodies that help to provide an additional look at what's going on within the facility itself. For those who have never used an oversight agency before, they can be especially helpful if you've noticed very alarming rights violations of survivors. You can also contact them on a survivor's behalf, and you can encourage survivors to contact them directly. If you're working with a CDCR facility, this is the Office of the Sexual Abuse in Detention and Elimination Ombudsperson, and it's through the Office of the Inspector General. So this information can be seen on the slide. And they're responsible for overseeing what happens inside CDCR state prisons and to ensure impartial resolution of inmate sexual abuse complaints. Not only can they look into investigations and what happened there, but they also may be able to help with housing, including transfers for survivors who've been victims of sexual abuse. Survivors can write to them directly using legal mail, and all they have to do is write on the outside of the envelope legal mail, so that is kept confidential for them. For county jails, some do not have an oversight agency, but we do encourage you to look into this. And if your county jail does have an oversight agency or even a board that looks into what's going on at the jail, to develop a relationship with them so that you can use them when advocating on behalf of your survivors. We want to encourage you also to share this oversight information with the survivors themselves so that they can self-advocate at any time they feel like their case isn't being handled properly. And you can use it as well when you feel like your client is unable to contact them directly or that there's been a pattern of concern you believe needs to be brought to their attention. So I'm going to turn it over to Marcella now to talk to you a little bit about in-person services.
Thanks, Chris. So yes, let's go ahead and talk about in-person services. Once you do have a solid relationship with your facility and have developed strong and sustainable programs for forensic exam accompaniment, letter writing, and hotline services for incarcerated survivors, the next step would be to look into starting to provide in-person support services, starting with one-on-one services and then starting to think about support groups. And unfortunately, this isn't currently possible due to the COVID-19 restrictions, but it can be something to think about and plan for when you're eventually allowed to go back into those facilities. So again, we're going to go ahead and start with a quick poll. We're curious to hear about how often your agency was able to provide individual support sessions inside detention prior to the pandemic, of course. All right, so it looks like about 33% of folks were meeting with folks at least once a week. That's awesome. About 10% of folks were meeting at least once a month or about 2 to 3 times every 2 to 3 months. And then about 50% haven't been able to provide in-person support services. No worries, we're going to go ahead and talk about how to get that set up. Thanks everyone for participating. So in terms of the support we give to survivors, it is really hard to beat the impact of in-person one-on-one support. So if this is something you're able to provide to survivors at your facility, you'll want to think through some internal setup before you begin. For those who are just getting started with providing in-person support, a good place to start is to determine what your capacity is for going to the facility. Perhaps it's only once a month, or maybe you have more time and you can go in once a week. So you'll want to make sure to ask about programming and what time makes the most sense for survivors to actually meet with you. So one idea is to go ahead and set up a regular recurring day and time that you'll be at the facility. And if you have determined that you can only go once a month, for example, you could go every third Tuesday at 11 a.m. And whether or not you have clients scheduled at that time, you should still show up, as this will give you the opportunity to connect with the facility staff and for them to get familiar with your presence in that facility. You will also need to think through how long you want your sessions to be and whether you want to set a maximum amount of sessions. You'll also want to make sure these practices are clear and written up so that a client has a strong understanding of your capacity before you even begin those services. Another thing to be very upfront with is your agency's policies regarding boundaries. Advocates are professionals who seek to help others, but just as in the community, some people may reach out to you for reasons other than their own healing. So it's best practice for all advocates to know upfront what is and what is not allowed, and to empower advocates to terminate any services if boundaries are set and then crossed. And the same thing if you are ever being threatened or harassed by a client, this is never okay, and you do have the right to terminate services with that person. So it can be super helpful to have strong policies and protocols in place for this, so that if something does come up, you can always fall back on your policy here. And you may already have policy around this for working with survivors in the community, so make sure to adapt that to survivors that are behind bars. And it'll be more likely that you are terminating services in the best, most trauma-informed way possible if you already have this set up. You will also want to ensure that your agency's counseling program policies work for individual sessions with incarcerated survivors. So for instance, what are the policies on cancellation or mediums of communication, as we spoke about in part 1 of our webinar series. So there are also some external pieces that you'll want to set up. You will need to find a confidential place to meet with your clients, regardless of the security level of their housing. Many advocates will meet with survivors in the same place that a lawyer meets with their clients, as that is often the most confidential space to meet. Other folks might meet in a room in a medical or mental health area, a classroom, or even in their staff offices. Next, you'll want to have a clear way that survivors can sign up for your in-person services. And so a good place to start is a self-referral through your hotline, or a letter, or at a forensic exam. So if this is the case, you'll need to make sure to get the survivor's permission, and best practice would be to also get a release of information for you to see them in person, and to work with the facility to set up those sessions. And you can also create a referral process for those who disclose sexual abuse or harassment at the intake process or with mental health staff at the facility. You will also need to develop a system with the facility itself on how survivors are able to actually meet with you in the facility. In some cases, survivors may be able to walk to where you are with permission from staff. Others may need to be escorted by security staff, in which case you will need to be mindful of confidentiality. And so if folks are in the SHU or in lockup, you may need to go ahead and go to them. And finally, it's always good practice to have a plan set in place in case of emergencies. So thinking about developing a plan with mental health staff for clients who are in imminent danger. Okay, so as I'm going through these slides, please feel free to ask us any questions about any of the slides that we've spoken about as we are getting close to the end of our webinar. So as far as providing one-on-one support to your clients, our work with clients behind bars will look very, very similar to when you're providing in-person support sessions with clients in the community. And so one thing that may take a little more time, though, is really building the rapport with your client. It's vital to build some level of trust with your client before diving into doing healing work with them. You get to leave the facility at the end of the day, and unfortunately, your client does not. This creates an inherent power dynamic that is important to be aware of. So you'll want to be mindful that folks that are incarcerated may be more distrustful of outsiders and professionals and other folks that are perceived as mental health workers. This is why you need to make sure that you're taking the time to really meet that client where they're at and to try to get to know them and hear about their experiences. So you'll need to demonstrate that you can be trusted, follow through with your promises, and be honest and transparent about what you can and cannot do. As with any client, you will want to make sure to set up the goals of your work together. This may be done on the phone or via letter prior to your first in-person visit. And you'll want to review these goals throughout your sessions and make sure that they're consistent with the survivor is still looking for. You will also want to be prepared in case your client is a non-English speaker, and that you have a policy in place about how they will receive services, and if applicable, how you will use a translation service. You will also want to validate your client's feelings as always and normalize any trauma reactions that they might bring up. Providing psychoeducation on trauma reactions may be applicable as well. Some survivors may want to use your time together to process and share their trauma experiences. So it's important to keep in mind that most survivors who are incarcerated come with a multitude of trauma experiences and may want to process those. And this may include child sexual abuse or domestic violence, or simply the trauma of being incarcerated. So you may also have the opportunity to work on coping skills with survivors during your in-person sessions, and this may actually be the bulk of your work together. And finally, you will always want to plan for follow-up, make sure that they understand when they can see you again, or that they can write and call your center in the meantime. Life in prison can be incredibly unstable, so it's important to always have a plan in place in case your client gets transferred before you're able to see them again. And so you'll want to be aware that each session could be the last, and to include really an element of ending in each session that could be reviewing a person's goals and plans and saying one thing about the person's progress. So I'm going to move on to things to prepare for. When you are providing one-on-one in-person support or groups, there are a few things to prepare for that may come up. Anytime you are in the facility, you may run across staff who are either unfamiliar or dismissive of your role and the services that you provide to survivors. You'll want to make sure that you're able to explain who you are and why you're there. And that being said, you will also want to make sure you can maintain confidentiality and that you're not being called the PREA person, or that clients are not being called out for talking to you, as that violates their confidentiality. Another thing to think about is how frequently clients are transferred. Always check the agency website to make sure your clients are still at the facility before you show up. Once you are there and your clients may not come to your session, remember that there may be many reasons that they're not able to show up. It could be a housing change, maybe they were added to a different work program, or staff isn't allowing them to see you. So keeping this in mind, try to advocate to talk to your client directly so you know exactly what it is that's going on. As we mentioned earlier, building a rapport with your client is a very important piece in building trust with them. And this may mean that your client takes some time before they really start talking about the abuse that you're there to work with them on. If there was just a massive fight at the facility, they may need to process this even if you had planned to talk through their child abuse during that session. So it's important to be flexible. It's enough to be a supportive presence for a survivor, even if their sexual abuse isn't the main topic of conversation immediately. Many clients need multiple sessions to build trust with you before talking directly about the abuse. And that is important to think about if you want to offer more sessions to clients who are incarcerated than you normally would to clients in the community. So outside of the COVID-19 pandemic, if you are being denied access to your client or to the facility itself, you want to make sure you're doing your best to try to get inside and to stress to see them. And so this will obviously take a lot of relationship building. And so if you're still unable to see them, you'll want to make sure to communicate with your client via letter or phone if possible, why you couldn't see them and when you'll be able to get back. So really quickly, I'll pass it on to Matthew.
Thank you, Marcella. And we do have time for some questions. If I know we're just about at noon where we said we would end, but Marcella, Chris, and I will stay on if anyone has questions. This does kind of conclude the formal presentation. We want to thank you all for being with us. And we'll close here with the words of Matthew, who is a prisoner rape survivor, whose words I think really reinforce what we've been talking about today about the importance of advocates when it comes to healing for incarcerated survivors. I got myself out of that horrible situation, Matthew puts it, and started going to therapy, and with the help of two amazing advocates that put so much time to help, I took control of my life again. So that is a success story and illustrates the power that you all have. You are the experts, even if you sometimes feel, oh no, I don't know what I'm going to do. This is a foreign environment. Remember that the advocacy, the support that you're providing to survivors at the end of the day is no different than what you provide to anyone in the community. We will be sending out an email to you all with a certificate of attendance for today. It will include links to some resources such as this toolkit developed for advocates beginning to work in facilities, providing kind of an overall sweep of the problem, some of the dynamics, and a close-up on vulnerable communities in detention. We'll also be sending a link to this great tool for internal trainings, as a complete facilitator's guide and slides and a script that can help you train your advocates and volunteers. You're always welcome at our websites to find out more about this issue, and we go to the PRIA Resource Center ourselves when we have questions. All right, everyone, please take care, stay safe, and we will talk to you soon.